Welcome to today's Medicare 360 radio show. My name is Jennifer Lee, your host today. We are going to go over the sandwich generation, helping aging parents while planning your own retirement. So this is where we help families navigate Medicare, healthcare, retirement, and real life decisions that come with aging. Today's show is going to feel a little different because today's conversation isn't just about Medicare. It's about life. It's about the million of adults who are helping aging parents, right? I'm at that point too, raising children. I have children 14, 16, 18, managing careers. As you know or may not know, I am a business owner and then trying to save for my retirement, right? Because things are definitely moving fast and quietly carrying stress from just every direction, right? That's what so-called life is, right? So this group has a name. It's called the sandwich generation. Caught in the middle between caring for your parents and supporting your children. And if that's you, you are absolutely not alone. So today we are going to discuss how Medicare affects families, signs parents may need help, right? Because, all our lives we've been asking more or less our parents help, right? Now the roles could be reversed, and it's something for both parties that's quite very different. What financial stress feels like, healthcare decisions that you do have to make. Then there's also the caregiver burnout, and then just real life situations. And if we have time today, I'll definitely go over my family situation and how to prepare before a crisis happens. So preparation is definitely key. It's always good to have things prepared when you're not emotional or you're not up against time or pressure. Because one of the hardest parts of adulthood is realizing at some point the people who once took care of you may need help from you, right? And then also them just not wanting to lose their independence as well. So why is this becoming a national issue? It's no longer a small issue, right? People are definitely living longer. Healthcare is definitely more complicated. Retirement costs are rising. Oh, that's a big one. And adult children are becoming caregivers while still trying to build their own financial futures. So many people are simultaneously paying for mortgages, helping kids through school, and no matter what age your kids are at, from newborn to adulthood or college or even, right, there is a lot of things we do to help with kids. I have one that's going to UCLA right now. And then managing aging parents' healthcare. So that's tough. So that emotional and financial pressure is definitely enormous. So the reality many families face, parents often say, I don't want to burden my kids, right? That's, I would say, the biggest one. Meanwhile, adult children are quietly worrying about, are mom and dad okay? Do they understand their coverage? What happens if there's an emergency? And many families avoid these conversations entirely until a crisis forces them, right? Like for me, I am in the industry, so I understand, so I have a better grasp. But for those that don't do this for a living, definitely is a learning curve, and you're learning about this as well. So what are the signs of aging parents that may need help, right? So this usually happens gradually, and we're so busy in our lives that, we just might not even take a step back and, just look at the overall picture. So this does not happen overnight. Families often miss the early warning signs because they develop slowly. And plus, like I mentioned, we're just so busy in life in general, right? Our lives, trying to live the best life ever. If you have kids, there's so many kid things, right? Activity, sports, emotions, right? Moodiness, things like that. Okay, so let's go over warning signs. Okay, so like warning sign number one would be confusion with Medicare mail, stacks of unopened envelopes. Parents say, I don't understand this right. And it could get complicated. Or I thought it was junk mail. And I mean, they just get so many letters, so many mail all the time, right? So sometimes too much, it's just like forget about it. So many seniors receive ANOCs. Those are the annual notice of changes. So that's a big one, right? Just last annual enrollment period, there was a lot of contract changes, a lot of network changes, medical group doctor changes. And if someone wasn't reading their mail, they definitely just missed it, right? Like their doctors got switched, just things like that. Okay. Bills. There could be bills, could be errors, right? Provider notices, like I just mentioned. That was a big one. Prescription letters, right? Because some prescriptions may not be in the formulary. And the dreaded scam marketing. You just hear these stories of seniors getting scammed with their whole life savings or their whole retirement. And it's just very heartbreaking. It does definitely become overwhelming. So warning sign number two is missed medication, right? You notice expired medications, missed refills, confusion about prescriptions. This can become quickly very dangerous, right? And then warning sign number three, missed appointments. Parents forget doctor visits, specialist appointments, follow up, or they avoid care altogether because healthcare feels confusing. And then warning sign number four, denial or fear. Many seniors fear losing independence, burdening family, or just appearing vulnerable, right? Like they're not used to this either. So they hide their problems. And the thing is, if your parents live independently, how often you see them, right? You probably slowly graduating to like needing more help, or if you don't see them very often, then you probably could see that big change. And then for those that your parents do already live with you, just a hustle bustle of daily life, you don't notice, right? Because it's just a slow progression versus like if they had lived elsewhere. So definitely like focus, take a look and step back and just, take a breather and, kind of see and notice these things if they are appearing. So let's talk about Medicare decisions become family decisions, right? So one of the biggest misconceptions is Medicare only affects a senior. It is not true. Healthcare decisions definitely affect entire families. So let's go over case study number one. A daughter calls because her mother's doctor suddenly isn't in network. The mother's upset. Daughter's trying to work full time. So now they're scrambling to find a specialist, transfer records, understand referrals, right? So this stress impacts everyone. And they do have situations like this where it is time for family to become power of attorney, right? Because I do have clients call in totally fine, right? And then next minute they call the carrier and it's a totally different story where like they don't remember anything we spoke about, right? So definitely keeping your family in the loop, getting that power of attorney. Because the worst things that happen is they're in sound mind, they're fine. But then they get a scam call, then everything, healthcare changes, right? Or it's just the dreaded losing all their money to someone like Western Union. So it is definitely stressful. Let's go over another case study. Like a father ignores their Medicare paperwork. So a family later discovers unpaid premiums, right? And unpaid premiums basically sometimes means termination of policy. Then that means very little coverage or unlimited costs. Terminated drug coverage in missed enrollment windows. I don't know. I've just seen an influx of plans changing without the client's knowledge, or maybe they forgot, right? But like, it's just, please do not give your Medicare number to anyone. But even with that, like, these scammers are finding ways. Okay. So now adult children are trying to fix these problems, right? Under pressure. You don't know how this works. You're just trying to figure it all out. So definitely the important teaching moment here is that many adult children don't even know what plan their parents are on, right? Like, hey, like, I mean, obviously I know what my parents' plan is on, my in-laws, just because I obviously do this for a living, right? But most, I don't think, bother, right? Not that you don't care. It's just, your parents have been handling it for their whole lives, right? Medications, right? And that's a big thing too, because it's just like your parents are used to taking their medication, but what if they stop forgetting? So that has some adverse health reaction on that. Doctors are seeing, right? So definitely, I would definitely just take a look at all that information, save it, take pictures, so you understand what's going on if needed, and taking that proactive approach. So I did mention this, but the power of attorney and healthcare authorization. This is one of the hardest conversations families do avoid, but one of the most important, because it is so tough when your family is in the hospital or they're just incapacitated or not in the right manner, just, drugged up, right? Like, how do you figure this out for them, right? So what is a power of attorney? A power of attorney allows someone to help manage finances, healthcare decisions, insurance matters. And then without proper authorization, doctors may not speak to the family, insurers may refuse information, and hospitals may limit communication. So that's really big, to just get that done right away, right? But why do families wait too long? Because these conversations feel uncomfortable, right? Especially if you have multiple siblings, right? Like, who is going to take charge, or who's going to play these roles, right? And those are just kind of the family dynamics that you definitely want to talk about. And parents, usually they will say, I'm fine, right? So children may avoid the topic out of respect. Most emergencies don't wait for emotional readiness, right? Like, when there's an emergency is then like, oh, I wish I was prepared, right? But we just never really got around to it. So definitely take time for that. I mean, I would say if you have your own trust, make sure your parents have their trust, or just do it all at the same time, right? So teaching moment, the best time to plan is before a crisis, right? Not during one. It's just already stressful if you are on a crisis. Okay. So definitely there are financial pressures on the family. I mean, there are emotional pressures, right? And then tack on those financial pressures as well. So if you do become a caregiver, however your family decides to do this, it does impact savings, your family's savings, your parents' savings, your own, right? Work. Like, if you're still working, retirement planning, right? Because that definitely could take a toll. Just your mental health. Things like this is not tough. There's no one size fits all. And there's no wrong or right answers as well. So definitely common expenses families face is prescription cost, right? Just knowing how that works. Dental work. As seniors age, they might need more dental work. Transportation, who's going to drive them around, and home assistance if needed, medical supplies, hospital copays, long term care, right? And Medicare does not cover everything, right? Especially long term care. And that's that big misnomer. So, the long term care reality, one of the biggest understandings is that Medicare covers nursing homes. In reality, Medicare generally covers short term rehab, medically necessary skilled care, okay? Not long term custodial care. And this shocks many families, right? Because, oh, you think it's covered and it's just not, right? It's what, skilled nursing only 100 days, right? So keep in mind it's custodial, like the day to day, the living activities, right? That's not covered. Okay, and then let's talk about caregiver burnout, right? Let's just say the family can't afford care or you just don't want to entrust another person with care. So it is honestly a very big, stressful thing, right? You probably don't have experience in caring for the elderly, right? And then on top of it, if it's your parents, like the dynamics of that, right? And if you have stubborn parents that want to be as independent as possible, right? So, caregiver is physically exhausting, emotionally exhausting, financially exhausting. And many caregivers feel guilt for even admitting it, right? Like there's just a lot of guilt to that. So, what does caregiver burnout look like? Anxiety, fatigue, irritability, right? And just not to who you're caregiving, your loved ones, but to those that are surrounded, like your family, your spouse, husband, wife, kids, right? Friends. Sometimes we could take it out on them. Depression's a big one. Just feeling overwhelmed, neglecting your own health. So many caregivers are so focused on helping others that they stop caring for themselves. So biggest thing, please, important message, helping agents is an act of love, right? But caregivers need support too. You need to be relieved of your caregiver duties sometimes. Take a break, right? I know it's tough if you're the only one that could be relied on, or, only child or whatever it may be. But please, take time to self-care, right? Self-care is very important nowadays, and it's so definitely true. So now let's talk about how families can prepare early. Let's say early, right? Here are some practical steps families can take. So step one, start conversations early before emergencies. I mean, I'm in the healthcare insurance industry, and I haven't really gone over it with my family and my parents, right? Here and there, little things, but fortunately, they are still dependent, right? But there may be a time, right, in a few years that we should probably talk a little bit more about it. Step two, understand the Medicare plan, right? Definitely know their doctors, their prescription, their medical groups, hospital systems. Sometimes they have the best care, right? Or they're just so used to it. Sometimes maybe their care is not that good. And I know change is hard, but having good quality doctors, medical group, specialists is equally more important in my opinion. Step three, organize important documents, right? Like keep that Medicare card, insurance information, Medicare list, physician contacts, make it accessible, right? Make a file, a folder, or something on your computer. Step four, discuss power of attorney. This is super important and crucial. Be it like their trust. If they have a trust, please revise it. They don't, get a trust. And then just be that power of attorney so it's easier to make decisions if the time comes they aren't unable, right? And then step 5, check in regularly, right? Especially regarding medications, appointments, mail, cognitive changes. It's definitely hard if you're on the other side of the country. But these are the things that definitely you do want to start checking in, right? Just making sure. And of course, if you do live with your loved ones, sometimes you don't even notice because like it's so gradual, right? It's like when your kids just pop up and become an adult, right? Like where did all the time go? And it's the same thing with like us, the sandwich generation. Okay. So that was a lot, right? If you just remember one thing from today's show, let it be this: healthcare decisions are family decisions, right? Just don't put it off. I mean, personally, I guess I've been putting it off too, right? And both sides, I've been putting it off with my parents because they're still quite fine and able and independent, and then my other side, which is my husband's side, right? His parents had Alzheimer, dementia, right? And it's just like, obviously we didn't really talk about it before. And it's tough, right? When you're not the sole decision maker, when there are other siblings and so forth, right? So just a lot to consider. One of the greatest gifts families could give each other is the preparation, communication, and support. I mean, I hear so many either great stories of all siblings helping, getting together. And then unfortunately, I just hear of horror stories, right? Like I'm the only one, and my sibling made my family, my parents sign a will or to put the house in their name, and I'm the caregiver, right? So there's a lot of things. Hopefully, you're not in that situation, and that you could definitely tackle this early than later, right? It is definitely stressful. I mean, I wish maybe we could create a class on it, right? Because people don't want to really look at this, right? But maybe if there's just something that you definitely have to do, you're going to just get it done. So for the caregivers listening today, what you're doing does matter, right? It doesn't go unnoticed. And to the aging parents listening, allowing loved ones to help you is not a weakness. It is definitely a partnership, right? At Medicare 360, our mission is education first, helping families navigate Medicare and aging with clarity and compassion. Definitely, we are a resource to you. We love to help your certain situation, understand what's going on, understand the plans, understand the resources. So thank you for taking the time to spend this time with me. I'm Jennifer Alfonso Lee, your host, and this is Medicare 360, where clarity always comes before coverage. You have a wonderful day.